My name's Mercy Karoki Mwithia. I'm from Nairobi, Kenya. I'm a mother and I'm a wife. My journey started at HCG in 2012 when I was diagnosed with breast cancer. I underwent treatment. I started with surgery, then I did chemotherapy, and I did radiation.
Talking about Mercy, I remember her seeing her for the first time in 2011. Now it is 2022. She has had 4 different cancers in different timeline. But the first 3 cancers, all the 3 cancers are completely, 3 cancers are completely cured. And the 4th cancer now she's showing the first metastasis.
I was on remission for 5 years. I kept on coming for my regular checkups. That's when I came, they found out the cancer is back on my cervix. They started me with radiation. I did chemotherapy and I did brachytherapy. Went back to my country, was doing very well. Dr. Sridhar was checking on me, everything was going well. I kept on coming for my usual checkups.
So when we saw she was young, it's around 35 to around 38 years, and diagnosed with the breast cancer. Then when we examined her, we told at that time actually lot of places in Kenya they used to do chop off the breast. She has consulted some of the doctors and they told that we need to remove the whole breast. So she was looking for other options of breast conservations. When we examined and we say there is definitely hope for breast conservation, which is our norm in HCG. All patients undergo breast conservation treatment. So on that basis, then she came here and we called her and do chemotherapy, radiotherapy and surgery, breast conservation surgery. For surgery and radiation, she stayed back. Chemotherapy, she took it back home. And she was on a regular follow-up and judiciously she has followed all of our recommendations. And after 4 years, actually, when we called her for PET CT scan, examined, she had a little bit of bleeding. When we did the PET scan, we diagnosed the second malignancy cancer of the cervix. On the background of what she is seropositive, which is treated for the HIV, so then it is we treated effectively her, and that went off complete response.
And in 2017, after my PET scan, I was diagnosed again with esophagus. They started on me. I did surgery. They removed my esophagus, part of my stomach, and I went back home and I healed well. I've been well. I've been keeping on well. Everything has been fine. I came back last year, 2021, for my checkup. Everything was fine. I've come back this year. I've been here for 2 weeks after my regular checkups. Now I have cancer of the liver.
And then when she was on a follow-up on last 2 years back, that is on the 7th or 8th years, when she comes for once in 2 years for the follow-ups, we found an esophageal cancers. So all other cancers were gone. This esophageal cancer was early and we did a robotic surgery for her.
So far, so good. They've done all their diagnosis they are doing. They are really helping. They are really working. The doctors are working so hard under Dr. Sridhar, who is my doctor. I'm so glad for him. He's made my journey be easy. And I thank all the doctors, from the chairman to the staffs even who clean here. Because my life has been so good. I'm home when I'm here. And I thank God for HCG. If it were not for HCG, I wouldn't be alive today. If it were not for Dr. Sridhar coming to Kenya, I would not have known this hospital. And I'm so thankful to God. Thankful so much to Dr. Sridhar, for he has taken me as his own, even the hospital. They care so much, from the staffs, from the nurses, to all the doctors. They care so much, they understand so much, they are so loving and kind. And I take India as my second home. And when I'm here, it's not like I'm in hospital, it's like I'm at home.
So what is important here is, like, she had a faith in us and we are treating her effectively. So coming to the one particular person, place and treating effectively makes a lot of difference. And it becomes like a relationship, and we are treating her like a family, as if that is our own sisters or then the family members, and treating effectively.
And I thank the hospital so much, from the chairman. And I know, I call myself a cancer warrior, because I know the treatment that is in HCG, my cancer will go as usual. And I'll live to testify about this hospital and about what God is doing in this hospital, saving lives, working 24 hours, caring and giving their best for the health of the people. Thank you.